Hello, my name is Franz. I'm a child and adolescent psychiatrist and Associate Director of the Duke Center for Autism and Brain Development. Thank you for taking the time to listen to me talk about our new publication, Early Intervention for Very Young Children with or at High Likelihood for Autism, an overview of reviews. Thank you very much to Developmental Medicine and Child Neurology, and you can find our paper in their journal. Early intervention for young children with developmental differences, including autism, is based on the notion that support early in life leads to better long-term outcomes. Public policies in high-income countries, in addition to emerging policies in lower resource countries, promote early identification and family-centered early intervention services. Numerous systematic reviews and meta-analyses on autism intervention have been published. While these types of publications can certainly be helpful in generating clinical guidelines, when many systematic reviews and meta-analyses exist on a specific topic, it may be challenging for decision makers to synthesize these findings. Furthermore, several recent systematic reviews and meta-analyses include participants across a wide age range, which may limit the applicability of these findings to younger children. In addition, very few systematic reviews and meta-analyses have critically appraised outcome measures used to assess intervention effectiveness. To synthesize a literature on early intervention for very young children with or at high likelihood for autism, and identify which interventions are supported by evidence and the quality of that evidence, we performed an overview of systematic reviews and meta-analyses published within the past decade. We aim to explore the contributions of all studies included in the systematic reviews and meta-analyses. We examine the presence of study overlap to better understand the sources of provided recommendations, individual study designs, interventions included, noting comparison groups when present, intervention intensity, duration, delivery agent, and measures used to assess child outcomes. We summarized the evidence from all primary randomized control studies to synthesize which interventions were supported by evidence and assess the risk of bias for primary studies that included control or comparison groups. As best possible, we followed Cochrane guidance on how to perform an overview of reviews. We identified 7 systematic reviews and meta-analyses that met our inclusion criteria, which included 63 primary studies. There was significant overlap in the primary studies included across the systematic reviews and meta-analyses. These primary studies included a wide range of study designs with considerable diversity in intervention approaches and control groups when present. Child outcomes varied widely across studies in terms of their content focus, outcome proximity, and boundedness. Furthermore, there was significant variation in the dose of intervention, delivery agent, interventions and intervention setting across primary studies. This heterogeneity in study design, intervention, and measurement had an impact on how results were reported in the systematic reviews, with 3 reviews providing only narrative summaries of results. Inconsistent methodological quality and potential biases were noted across critical AMSTAR2 domains in the systematic reviews, and serious concerns for bias were identified across primary studies with comparison or control groups. Examination of all primary studies that included control groups identified various naturalistic developmental behavioral intervention, developmental, and behavioral intervention approaches that significantly improved child outcomes. The greatest intervention impact was seen on proximal intervention-specific outcomes, with less impact being documented on child outcomes measured using distal standardized assessments. While this was an expected finding, given that previous studies reported greater intervention effects on outcomes that measure intervention-specific skills, this finding matches for the interpretation of autism intervention evidence in children aged 36 months or younger. So in summary, while our overview of reviews identified numerous early intervention approaches that had an impact on child outcomes, limitations in the quality of the evidence, heterogeneity in measurement, heterogeneity in comparison groups, participant profiles, as well as intervention dose, really limit our ability to conclude which interventions are most effective. This conclusion is not entirely dissimilar from reviews of autism interventions that have included participants across a broader age range, suggesting that as a field, autism intervention research may face similar challenges across age ranges in approach, design, and measurement. Thank you so much for your attention.